Malaria kills 1,320 children daily. The world heaved a sigh of relief when the World Health Organization announced the approval of the malaria vaccines. Today on the program, we are taking a look at innovation and details about NAFDAC's approval for trial in the country. Good evening. Welcome to Soundhealth on Lagos Television. I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
The dream of a malaria vaccine has been a long-held but unattainable dream. Today, the RTSS malaria vaccine, more than 30 years in the making, changes the course of public health history. Using this vaccine in addition to existing tools to prevent malaria could save tens of thousands of young lives each year. This vaccine can be delivered through child health clinics by ministries of health and readily reach children at high coverage levels. Community demand for the vaccine is strong. It has broad reach to children, including the most vulnerable, who may not use a bed net, thereby expanding access to preventive measures to children at risk. It is safe. It significantly reduces life-threatening severe malaria, and we estimate it to be highly cost-effective. This is a vaccine developed in Africa by African scientists. This vaccine is a gift to the world, but its value will be felt most in Africa because that's where the burden of malaria is greatest.
Joining us via Zoom this evening is Dr. Mariam Oshodi, a public health physician, and she is going to tell us about some efforts at eliminating malaria and the malaria vaccines. Good evening, Dr. Oshodi, and thanks for joining us.
Good evening. I'm glad to be here with you.
In 2021, nearly half of the world's population were at risk of malaria. The world also reported anti-resistance to a malaria drug. What's your concern about this development?
Yeah, like you rightly said, in 2021, nearly half of the world population are at a risk of having malaria. And as a matter of fact, on a yearly basis, we have about 247 million cases of malaria. These are according to the World Malaria Report. Unfortunately, Africa has the highest burden of malaria in the world globally because we have 95% of malaria cases that occur in Africa, and as well as 96% of malaria deaths occurring here. Unfortunately, on the that is children aged below 5 years, account for most of these malaria cases. So we can see that in Africa, we need to take extra intentional efforts to ensure that malaria is eradicated. Now, part of the recent efforts that have been put in place for malaria eradication include some of the following strategies. Part of it is early case detection and prompt treatment of malaria. And that involves ensuring that children that are or people that have malaria are promptly tested and given proper medications. Unfortunately, in this part of the world, our health seeking behavior is a bit poor. So people do not even go to the health facility when they have malaria. They go and get over-the-counter drugs where they can easily purchase by themselves without any prior investigation or any prior consultation of the health personnel, and then they use these drugs. So part of the strategies include early case detection and prompt treatment, like I have said. Also, community participation is also one of the things that have been encouraged. Community participation being that it's increased sensitization of people in the community. They need to know that these are the ways malaria is being transmitted. So we need to ensure that there are no breeding grounds for malaria. They ensure that there are no stagnant water anywhere. They try to clear the bushes around their homes. They also ensure that they have any water storage or in containers. They ensure that all those water storages are covered properly. Another strategy is also vector control. Vector control can either be chemical, biological, or the use of prophylactic measures like the use of insecticide-treated mosquito nets. So where is encouraged vulnerable group like pregnant women, the infants, children under 5 years, travelers to ensure that they sleep under treated mosquito nets. Also, we also encourage that in homes they have the wire mesh across their windows and the doors to prevent mosquitoes from getting into their homes. Also, the biological treatments include the use of larvae fishes that could take up the larva of malaria parasites in their breeding sites. And also, chemical measures include the use of insecticide, the use of indoor resistant sprays like the fleet or the insecticides that we use to spray to prevent mosquito from surviving in our own places of residence.
All right, Dr. Oshodi, thanks for that detailed explanation. Okay, thanks for that detailed explanation.
I just wanted to mention. Sorry, I wanted to mention the last measure, that's the environmental methods, such as ensuring that the drainage sites are properly, we do not pour dirt into the drainage, because once the drainage sites channels are blocked, they give room for us to have stagnant water, and then they form breeding sites to malaria parasites. So that's part of the environmental control.
Okay, how did you receive the news of the vaccine, and where are we in terms of administration?
The news of malaria vaccine, it gladdens the heart, because malaria is, when you see children, people that do not deserve to die, passing away because of malaria, it's very sad. So the news of us having the malaria vaccine available, particularly that it is now approved in Nigeria by NAFDAC, was an overwhelming news, and it's something that brings so much joy to the heart. Now we're just waiting for the implementation, because malaria vaccine being available has to go through the proper channel, which NAFDAC has been putting in place, and through partnering with the National Primary Healthcare Development Agency, that's the NPHCDA, in the administration of this vaccine. We would ensure that this vaccine gets to the appropriate channels as soon as possible.
All right, is this vaccine for everyone, and will it be listed alongside other vaccines for the routine immunization?
So so that's the plan. The vaccine is planned to be incorporated into the routine immunization schedule for the children. It's targeted at children 5 months to 36 months of age. That's less than 6 months to 3 years of age, and it will be internalized into the schedule for the immunization. Now, it's not readily available for everybody. We know that this vaccine is not so available in large quantities. So we have to start with the vulnerable group. And like I had mentioned, part of vulnerable group was on the 5 that I had mentioned earlier on.
What measures do you think can be put in place to check conspiracy theories, vaccine myths, like we experienced during the COVID-19 era?
Okay, so like we experienced during the COVID-19 era, having people not wanting to take up the vaccine. Now, this is malaria vaccine. Number one, is not even readily available. So first of all, prior to distribution or availability of the vaccine in health facilities, sensitization needs to be carried out. So increased sensitization of the caregivers. Now they are bringing the children for routine immunization. So right now we need to start telling them, oh, there's a new vaccine. Everybody knows about malaria. There's a new vaccine, and it's the malaria vaccine that's going to prevent the children from getting malaria. Malaria is a very common disease in these children. So it's important that they know that, oh, yes, this is a vaccine that's going to prevent your children from having malaria, and that they are bringing it very soon. So we'll start passing the message on to them. And then when they have, we also have broad health education, so that they will know that this is what the vaccine is about. This is what's going to work. This is how it's going to be administered to your children. These are the time durations that you come to the health facility for this vaccine. These are maybe some of the side effects you might see when you come to this, when your children take up this vaccine. So, once they are enlightened, the resistance or the vaccine hesitancy will be reduced. They also pass on the message to their husbands, because there are some families that the wife is not the decision maker in the family, and they have to take permission from their husbands. So they're already passing the information to their husbands, or maybe their in-laws, or people that are core decision makers in their family. And then they are also they're already aware. And they also need to understand the fact that this vaccine is limited, because it's not readily available. So it's of high importance that their children are able to get this vaccine. Also, apart from sensitizing the health workers, availability of the vaccine is also key. So we know that we ensure that all the transport measures and necessary cold chain things, apparatus and measures for us to have the vaccine available are already put in place, because it won't go well when people come to the facility today to ask for the malaria vaccine and they get it today and they tell them, no, you have to come back in a month's time before you have it again. Those are part of the factors that also discourage people to take up the vaccine. Also, proper training, I'm sure, will be put in place for healthcare workers that will be administering this vaccine. So they know, oh, yes, they have been administering different vaccines, but malaria vaccine is new, is novel, and it's they've not administered that before. So proper training will be put in place for the healthcare workers that will be administering this vaccine to the children, and so they will know exactly what to do. And then also, perhaps, if there are side effects, they will know how to manage some of those side effects, and also give the clients their proper appointments when next for them to come and take their vaccines.
Can you tell if
some of measures that
okay?
Put in place.
Can you tell if it's a single dose vaccine or a double dose vaccine now?
Okay, well, as of now, it's a triple dose vaccine. It's going to be given 3 times under the span of, I think, 6 months to a year. But you know, a good number of our people do not always come for. Some of them might not come for the vaccine as scheduled, so it's given in that span. But for now, it's still stipulated to 3 doses. Until when it's been approved and final paperwork are done, if there is any change, you know, for the vaccines to be administered. But you know, more importantly, we want at least a child to have at least a single dose. You know, at least to have a single shot of the malaria vaccine. So that also might also determine number of doses a child will be able to get. You know, so at least most children are given fair opportunity to be able to access the vaccine and take it up.
A major challenge pointed out by the World Health Organization is getting across to hard-to-reach population. What do you think should be done to change this narrative? Because people in the hinterland, if we're not careful, might miss out of these huge benefits.
Okay, so for people in the hard-to-reach areas, the hard-to-reach is defined by several factors. Some of them might be very poor, inaccessible roads. Some of them might be in the riverine. And then, so there are already measures that have been put in place depending on the peculiarity of each of these areas. So in places that are riverine, for instance, we know that, yes, we need to know the areas, and the personnel will be sensitized early enough to let them know that, yes, we need these vaccines to get to these particular places. And then there are also measures such as clustering those children. We might not be able to get to those hard-to-reach areas, but if the caregivers, we can cluster them in a particular place and ensure that they bring their children, and then we give them the vaccine, and they go using like a hit-and-run strategy. In areas where we know that, yes, it might be transportation issues, we have to consider transporting the healthcare workers to those areas so that those children do not miss those vaccines. Also in security challenge areas, look at security challenge where the health worker is even at a risk. So look at people that live in those communities, that live in those communities, and they are able to know the terrain of their communities. So we adopt those people into the vaccination team so that they are able to ensure that the vaccine gets to those children. And also even in areas that perhaps they migratory places, maybe nomads or people that maybe they are affected by current rainfall in the rainy season, they might have migrated to some other areas. So we already know that, yes, in this particular month of the year, these people will not be in this particular location. They would have migrated to another region, so we'll know where they're migrating to, and also plan for them.
Dr. Oshodi, your call to action as we wrap up now.
As a wrap-up, it's important that all hands are put on deck for the malaria vaccine. Yes, it's been approved by Nigeria, and then we're saying that once the vaccine is ready to be administered to the populace, all hands need to be on deck, all proper measures need to be put in place. And it's very important that every caregiver ensure that you have a child between the stipulated age group, that child gets the vaccine. Please and please, it's very, very important. Thank you.
Dr. Mariam Oshodi, public health physician, thank you so much for your thoughts on eliminating malaria and the updates about the malaria vaccines. Thank you so much. We really appreciate your time.
Thank you. Have a good evening.
Right. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. This is where we say thank you on today's edition. Hope you've learned one or two things about today's episode. If you have topics you want us to take a look at, send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.